Hello. So we know it's been a long afternoon, so we're going to maybe do some high level, and hopefully this will be really helpful for everybody in the audience. Okay, so I'm Annie Kennedy. I'm with Parent Project Muscular Dystrophy, and it's really great to be back here with a lot of friends this year and then meeting a lot of other people. I think this session we were just talking is really a little bit, we're kind of switching topics a little bit. So this session is not about what you're going to be talking about on the Hill tomorrow necessarily. This is really about building relationships with federal agency partners. And this is something that probably everyone in this room will be, or already is, very good at. Because if there's anything the rare disease advocacy community is good at, is convening partners and building collaborations. And so what we've each been asked to do is talk about individual collaborations we have with respective federal agency partners. So that's what we're going to do. So PPMD has been building relationships with federal agencies for a little over 20 years. We're each going to give you just examples of some of the work that we've been doing, but we don't want anyone to feel overwhelmed or feel that you can't get this done. We know that Capitol Hill sometimes feels like a mountain, and when you come to Washington, it's a little bit like alphabet soup, and we throw a lot of acronyms around, and it doesn't make a lot of sense, and believe us, sometimes it doesn't make a lot of sense to us either, but our goal is to break that down for you a little bit right now. But again, it's really all about building relationships. So when we set out about 20 years ago, what we did as an organization is we really just, first of all, we were started by two moms. And as an organization, we've now expanded and include professional staff, but we're still an organization of about 15 people. But this is doable. It's doable as a community driven by patients. And so what we did is we prioritized what does our community, what does the Duchenne community need to get done? Where are the resource gaps? What are the barriers? What's our mission? And then we really group those into buckets. What's short-term, what's long-term, what will make the greatest impact for the families we serve. And then we set out to achieve that. And through the purview of federal agencies, we determined we were going to do that through legislation, because legislation would bring federal partners to the table. But that's not the only way to get it done. So for our example, we worked with our congressional leaders to pass a bill called the MD Care Act, which became banner legislation for our community and really catalyzed research funding in the muscular dystrophies. It brought federal agencies into our space and eventually brought industry into our space. And we've now had 3 iterations of that bill. And what that bill did is it really reflected our to-do list. Let me go back. Is that we really needed to improve care for individuals with Duchenne. We needed to fund research and build research infrastructure. We needed a coordination of the federal agencies and funding for the federal agencies. We needed data collection. We needed natural history studies. We needed outcome measures. We needed surveillance to understand who even had Duchenne and Becker muscular dystrophy in the US. And we needed to build a drug development infrastructure. And we've done all of that through working with our federal partners. So this is a slide that shows you which federal agencies we currently work with. And so what I would recommend is that you would just start by, again, making that to-do list. You probably have it. You have your strategic plan. You have your mission for your organization. And then take that list and cross-reference it with the missions of the federal agencies. And this slide shows you some of the federal agencies that really touch rare diseases most intensely. And NIH, when you say you work with NIH, many of you know that NIH is actually 27 institutes. We work with 7 of them. So, and Chuck is going to talk about working with the NIH more specifically. But then identify which of these agencies will most immediately be able to help facilitate your goals and make your priority getting to know that agency, developing relationships with that agency. So I was asked to specifically talk about CDC. So I'm going to talk a little bit about the work that we have done with the Centers for Disease Control and Prevention. I joke sometimes with the CDC that when we first started working with CDC, we work with all those federal agencies I just talked about. We work with 7 institutes of the NIH, and we spend a lot of time working with FDA. And CDC, though, I tell families that if you're a newly diagnosed family with Duchenne, if your child's now about 2 or 3 and you're receiving a diagnosis of Duchenne for the first time, CDC is probably the agency that will have impacted your child's life the most. Because the work that the CDC has done with us is the work that has really moved the needle the most to date in Duchenne muscular dystrophy. So the CDC is a member of what's called the Muscular Dystrophy Coordinating Committee. So one of the things that we have in muscular dystrophy is we have a federal coordinating committee of all of those partners that I just showed you going back that meets twice a year and sits down to talk about what we call the Muscular Dystrophy Action Plan. We've actually mapped out an action plan for the muscular dystrophies, and the federal agency partners each have contributed to that action plan and report on the activities they're doing with respect to that action plan. And the MDCC also includes patient advocacy partners who are a part of our space, who also talk about what we're doing in the space so we can avoid duplication and help move momentum forward. The CDC drives surveillance in the US. So this is epidemiology. So how many in this room have epidemiological efforts for your disease? Not many of us, just a few. So this is how we know who is actually living with our diseases in the US. These are the numbers that are critically important for tracking outcomes, for understanding as therapies come online, how those therapies will help reduce the burden of disease, how we attract industry into the space, to be honest with you, to let industry know we are rare diseases, but this is how many people live in individual states with these diseases. So this information is critically important. The care considerations. So one of the situations we had in Duchenne was that you could live in Baltimore or you could live in DC, and the type of care that you would receive from the physicians in those 2 places was completely different. And, goodness forgive if you saw a private provider in a very small area who didn't see a lot of people with Duchenne, because there was no consistency in the care being provided. There were no care standards. No matter how much that provider cared, there were no care standards. So again, we worked with the CDC to develop care standards. They're global care standards for Duchenne and Becker muscular dystrophy. They were published in The Lancet in 2010. And then, because care had improved and we were seeing care trends change in Duchenne muscular dystrophy, we went back to Congress and asked that Congress ask the CDC to update those care standards. And they've now been updated. They have some new domains in them, and they're now also getting ready to be published. The CDC also funds newborn screening. So I know newborn screening is really important to this community. And there are a couple different divisions within the CDC who have purview over newborn screening. But the CDC has been an extraordinarily important partner to us in our newborn screening efforts. They've provided funding for our earlier pilots in newborn screening. They're actually developing some of the science, the assays, and the cell lines to be able to do the technology and the validation of the tests that we'll need for newborn screening. And they sit on the Secretary's Advisory Committee of Heritable Disorders in Newborns and Children, so they're an incredibly important partner. So again, the other thing that we're very concerned about, so this is both ends of the spectrum, is newborn screening, earlier identification of patients and individuals with Duchenne, but then also we're seeing individuals with Duchenne live longer. So our community is a community of typically boys who are diagnosed usually by the age of 2 or 3. It's a 100% fatal disorder. So it used to be the life expectancy for Duchenne was right around the time you were graduating from high school. I'm thrilled to be able to stand here and say today that that life expectancy has increased by over a decade because of the care considerations and the fact that we are better care being implemented in the US. That is work that has come through these partnerships and clinicians and experts coming to the table and being convened by the CDC. But now we have an emerging adult population, and we have to learn about caring for adults. And probably like a lot of your communities, we have adults that then age into adult care providers but don't have specialists who know how to care for them, cardiologists and pulmonologists and neurologists who never have seen people with Duchenne before. And so CDC has been working with us on leading some of the issues around transitions. And so we've also been working with CDC on some of the data integration and health economics efforts, and they've been driving some demo projects with our state Medicaid programs. So how did we do all this? One of the ways we did it was legislation. Another way we did it was report language. So you guys we've all talked about the appropriations bill today. Sarah Chang gave a really nice talk about the appropriations bill today. And one of the things that accompanies the appropriations bill is a committee report that goes from Congress. So we think about the appropriations bill as like your family's budget, right? So you make a budget for your family, and it tells you how much you're going to spend on certain categories of funding for your family. You're going to spend this much on housing, this much on your car, this much on gas, this much on food, et cetera. But then you further specify what you're going to do with that. So on housing, this will be your mortgage, this will be your utilities, et cetera. The committee report are the details that go along with the appropriations bill. And you have an opportunity as a community to work with your congressional champions and the appropriators on the Hill to get some report language before the federal agencies that are of importance to you that actually spell out work that could actually benefit your community. And so as you start to develop relationships with individual champions in Congress, it might be worth considering, is there report language within HRSA, within the CDC, within FDA that would drive the work within those federal agencies that would be of benefit to your community. And then the last thing I'll say is, I think the most impactful thing you can do in developing the relationships with the federal agencies is to thank them for the work that they do. These are incredibly hardworking people who are working under unbelievable circumstances right now. Many of them don't know who their bosses are going to be yet, and what the climate and what the budget for what they're doing right now is. The budget for last year hasn't been approved, so they don't know. We've told them what we want them to do, but we don't know how much money they have to do it with. And they work really hard for us, and they're incredibly committed to the work that they do. And we have found that it's not just about thanking them, but it's about going to Congress and telling Congress when they're doing something really good for us, and making sure that they get thanked by members of Congress, because we're all, I mean, we do it too. We're really good about going to Congress when we need something done. We wrote it into legislation when we needed work done. But when it's working, when it's making an impact, we need to make sure that we're going back and saying, you know what, that work that the CDC did made a huge impact. Or all these people came together at a meeting, or they came and spoke for us, and we are so grateful for what they're continuing to do. Because that does go back to them. It goes back to their bosses, and it trickles down, and they will remember you. And they'll remember you the next time they come around and ask for something. So thank you very much. Chuck, you go next.